Well, hello there, ladies and gents. It is great to see you again, and welcome back to Path to Abundant Living. Ryan Ruff here, your moderator, but as always, I'm joined by the fellas in Matt Nordman and Scott Morrison of Morrison Nordman Wealth Management. And as we typically have been doing of late, we want to bring to you guys another great guest from a very interesting walk of life to share their expertise and of course, dive into some of the lessons and how that can apply to you and your greater financial world. So today we are super excited to be welcoming on our guest, Dr. Kimberly Ku. A little bit of background on her. She is a triple board certified doctor, and that's just quite an achievement in and of itself, but she's certified in those areas of oncology, hematology, and internal medicine. She's got a laundry list of stories and lessons and anecdotes that she's learned throughout her extensive experience, but also just her time treating patients during what can be some of the most challenging times in their life when they're battling cancer or any sort of really deep-seated issue within their health. So before we bring Dr. Ku on, we want to say hi to the guys, of course, and check in on them. Matt, Scott, how are we doing this morning? Good to see you guys.
Ryan, great to see you.
Hey, Ryan.
How's life in your household with a young one?
Yeah, it's sleep is a commodity at this point in time. We're working through it, but no, doing well, and excited to be back with you guys today. Of course, naturally the coffee's flowing, so the
Doesn't
viewers might be seeing
doesn't hurt
a
to
few
have
sips.
a little caffeine. Yeah, we learned with young kids, sleep is overrated. You'll catch up later.
Matt, I've realized how much I can achieve with such little amount of sleep, and I almost wish I knew that earlier in life. Could have been a little more productive, but either way, let's get into the fun stuff today. We've got Dr. Ku waiting aboard. She's going to jump on with us and dive into her unique world from medical field, given her experience. And so, with that being said, let's get her out here. Dr. Ku, it's great to see you, and thanks so much for carving some time out for us today on the podcast.
Yeah, for sure, Ryan. Thanks for having me. I'm really excited.
Excited to have you here, Dr. Ku.
Absolutely. We've got lots of questions.
With we tell people all the time with what we do in the wealth management, very, very important. But without your health, it doesn't matter. And so I want to ask, Ryan referenced that you are triple board certified, which is unbelievable. So what inspired you to pursue such a demanding path in medicine?
Yeah, thanks, Matt. That's really kind of you to put it that way. And I'm always, I like to be really straightforward with everybody. And I think about it like your audience probably has doctors or aspiring healthcare providers. And so, I mean, if you asked me 10 years ago, would I be triple board certified? I probably wasn't even thinking that way. I probably wasn't even thinking I would achieve like a tenth of what I've achieved now because I really was just thinking, like, what is my next goal? And then it just built organically. And so I think of it like when I was influenced by a lot of like what other doctors are, a personal encounter with someone with cancer, then it just became a journey of figuring out, well, what do I want to do with this that's going to be positive and it's going to be fulfilling. And I think the triple board certifications just kind of came along with it, but certainly not something that I would ever want anyone who's aspiring to become a healthcare provider to feel like they have to put that on like a checklist. So yeah.
Okay.
When I think of you as triple board certified, the thing that amazes me though is that the next question I have is that you consider yourself a community doctor. I don't know how many community doctors there are out there that are triple board certified, but what do you when you think of community doctor, how do you define that? How do you see yourself as a community doctor?
Yeah, I am definitely very biased when I think of community doctors with like a capital C and a capital D. And I think community doctors are like superheroes, honestly. It's because I think of them as uh the at the core, they take care of people just like any healthcare provider. And then they build multiple layers from there. Like they take care of the community as well, or they at least they think about all of what we in healthcare call like social determinants of health, like all the things that are not just the medicine, not just the short time that we have in the clinic together, but also what are all the things that, as part of the unique community, really affect patients' health that are different if you were to drive even just an hour or two to another zip code. So I think of it as they're very entrepreneurial and enterprising. They think about multiple dimensions of problem solving in order to help care for patients, care for people in general. And it takes a lot of, I think of it like could be a community doctor and not even be necessarily a doctor. Like you could be taking care of the community in so many ways. Like for example, being wealth advisors and making sure that the livelihood is being taken care of. So I have a very broad definition, and it comes a lot from the intent and the professionalism and just life commitment.
And Dr. Ku, you yourself mentioned a moment ago that there's kind of a lot of doctors have personal experiences that kind of push them into the medical field. I'd love if you could share yours and walk through kind of what that defining moment really was, or maybe it was a patient experience that kind of changed your view of health and your kind of your own sense of purpose.
Yeah, yeah, for sure. And I share this with all my patients too, is I actually had a friend in college who died of cancer at a very young age. And so that really informed me about the way I think about healthcare versus the way that it seemed to be an experience. And it just made me think deeper about wanting it to look a certain way that maybe would have been something that fit better, I feel like, for myself, for my friend, for their family, and wanting to embody that in terms of being a positive force and thinking that healthcare in general could use a lot more people who want to help make it better. So that kind of an experience informed me in terms of wanting to do a lot of research, but at the same time learning a lot about communication skills as a hard science and being out in the community. So actually driving around and going to outreach clinics to meet patients where they're at. I think all of that collaborative spirit comes from having that personal experience myself.
You talk about the experience with your friend and obviously with a number of patients, and you walk patients through incredibly tough seasons of life. How do you help those patients and their families focus on not just surviving, but really living fully as they go through this process?
Yeah, I think of when they come to see me for the first time, there's definitely a lot of uncertainty, a lot of fear. It's probably like when you have clients come to you for the first time too, and just feeling like you want to give them that unshakable sense of confidence that they're going to be able to have some type of a legacy that comes from this experience. And so whenever people come to me, I try to observe what their emotional state is and articulate it and then just go on that emotional state with them. I really don't presume myself to be someone who will be able to say to someone, let's like be extremely positive and let's just be positive all the time. Sometimes they really just need to say all of the negative things and be heard, and then they can actually conjure up their own resilience and go, I'm going to find my own meaning to this. And they really need a doctor who can just listen and witness and hold space for them.
So have you studied psychology at all? Because it sounds like that's part of what you do on a daily basis.
Yeah, I'm very evidence based. And so I love studying all forms of sciences. So I'm very into, yeah, psychology, but I think in the many manifestations as it comes in, like I've studied, like Ryan knows, studied hostage negotiations. I'm very into tactical empathy. I also am a big fan of the kind of thought process that goes into like personal coaching. And so I learn from a lot of folks who've already done it and they've produced evidence, and I model that kind of behavior because it fits my style too, and it really does it yield meaningful results for people.
Which I love. You're a lifelong learner. That's what I love.
Well, one of the things that you mentioned, you kind of brought in the financial services, the wealth management into the discussion, and we ourselves have experienced a lot of changes in the industry when it comes to the behavioral side of things. And so, instead of talking about just stocks and bonds and mutual funds and all the nuts and bolts of the investing, is being more empathetic with our clients and finding out what's most important to them. Uh, Having said that, what misconceptions do you think that people have, in terms of cancer prevention and just that moment that they realize they've been diagnosed with cancer? uh, it would be very easy for you to use as a crutch just purely your medical background. How do you address the misconceptions about when somebody hears for the first time that they have cancer?
Yeah, I think a lot of people when they're afraid, they're looking for anything that will give them any semblance of certainty. So nowadays, there's probably a lot of like going to social media or going to influencers, and it's not always easy for the medical providers to be asked all types of things that aren't in line with what we're trained to actually talk about or has evidence base. But I do think about it from the way the patients are coming, where they're trying to inform themselves and be educated, and they're emotionally invested in the work that they put in to try to give themselves certainty. So again, I open up that space to listen to what makes them think that, for example, we get a lot of questions about the validity of vaccines or types of things that aren't clinical trial based, and yet they think will cure the cancers, or they might think a lot of different medicines cause autism, and these are all things that are being put out in the public because they're really just looking for anyone and anything to try to help. And then when they do work, they get very proud of the effort they put in to help themselves. So I listen very carefully, and I try to articulate that I can tell that they're trying to be agents of their own health. And I really ask them permission. What are they wanting me to do to help them? And they'll actually then ask me, like, is this true? They'll give me permission to challenge. And I think it's that process that's really important, as opposed to immediately saying, well, this is the data, and whoever you heard it from is not a doctor. I think most patients know that, but they're really looking for someone who understands that their decision-making process, independent of being a medical profession or not, is respected so that they can really trust having a conversation with their doctor.
It has to be in the number of interactions you've had with people. It has to be really interesting when especially with the internet and all the information that is out there, and then the number of people who are online experts, like you're saying. It's like, well, this person says this, or well, I know someone who took this thing, which, well, now they're all better. And so for you to then not just completely dismiss it, but actually listen to those concerns is it's great to hear, because there's I'm sure you know people, we know people in our industry where they just completely aren't open to, hey, maybe we don't know everything. Let's listen to what someone has to say.
Yeah, and I learn a lot about social media and the way that they get their information. It actually is very enlightening for me. Not so much the medical part where I feel like then I can provide the education, but I'll actually voice like, "Oh, that's very educational for me that you're letting me know this is what people are hearing and seeing." And I think it's really important to be that deferential and when working with people, giving them that feeling that they're actually a partner and not like I'm the high mighty doctor and they're kind of this low patient who has to just be okay with my triple board certification. No, I think of it like you know, some of my patients who have some of the worst times, the worst prognoses, like everything that's terrible, what gives them a lot of hope is the relationship we have that they know I'm actually learning from them and I'm gonna remember them and I'm gonna take what I learned to help someone else.
But it sounds a lot like what we talk about, what you do is people are coming to you looking for that confidence of, am I going down the right path? Right? Hey, I heard this. Can you help me understand? And you are triple board certified. Not that you're not touting it, but you're like, hey, you know a lot that can help a lot of people. So they come to you looking for confidence. So I love that. So from your vantage point, what are the habits, like physically, mentally, emotionally, that have the biggest impact on long-term health and longevity?
Yeah, yeah, for sure. So I have pretty nerdy answer to this one, like everything other answer I have. But like I studied anthropology a lot growing up. I was just really interested in like cultures and civilizations, and I thought about how as humans, the things that helped us evolve, we've gotten very far away. So even just being able to walk on two legs is quite an evolutionary accomplishment. And so I as a very strange young person, took that very importantly as a habit that I always looked at it like I'm gonna run, I'm gonna walk to everything, I'm gonna climb stairs, I'm gonna do like a standing desk. It's just a built-in part of my thinking that it's healthy for a human body. I try not to be using terminology sedentary, but that's really what the heart of that issue is that when we're ignoring what it is that helped us evolve, then that actually becomes its own health epidemic is that sedentariness. So I think of movement, honoring what it is that helped our bodies become so resilient and vibrant as they are now. That includes like hydrating really well, at least half our body is water, so I'm thinking constantly about, like, good quality water, like, Diet Coke doesn't count, I break that rule a lot, though. So, those are the kind of physical things I think, and then mental, definitely keeping a healthy mindset, eh, easier said than done, but, like, thinking about what can I focus on that I can control? Because if I think about the non-controllables, it's there's nothing that can be done about that. It's good to acknowledge, but think about what you can control, then you can start planning action and you can look at your world as actually there's a lot in our control and we can actually change our realities quite a lot. And also what we have instead of what we don't have, because that comparison feeling is just a spiral of negativity. So spending a lot of that time trying to pivot, going like, okay, I'm focusing on what I don't have. So I need to think about, well, what do I already have? And the irony is that once you start thinking in that way, you'll start accumulating more and you'll start feeling this relentlessness, like I can do more, I can be more, I can be more impactful. Cause then you start not feeling like you have to need so much and you see all the need around you and you really want to be influential and impactful for everybody else.
Comparison is the thief of joy.
Yeah, yeah. I forget who said that. I feel like it's
Uh,
either like Mark Twain or Socrates or Pluto or I don't.
Yeah, I'm gonna have to look it up because I've used it before, but you would reference it, so yeah, I should probably know who I'm quoting.
Yeah.
Well, well, Dr. Ku, our show focuses on abundant living, and we look at the word abundant in so many different ways. It'd be very easy to translate that into wealth, but we look at abundant living as something much bigger than that. Curious how you personally define abundance.
Yeah, I love this question because I think of abundance as a decision. Like you can decide how abundant you want to be. And abundance, I feel like it leaves clues for other people who are on that spectrum of abundance and wanting to decide to do more behaviors that are aligned with that kind of a thinking. And what I specifically mean is, I, I I think anyone knows in this world, there's a lot of bad things, just like there's good things. And just because someone's positive doesn't mean that they are somehow naive or weak or stupid or unable to protect themselves. But I think a lot of times positive people, empathetic people, kind people get taken for granted that it's just they're blindly optimistic. But I think abundant people are fully aware of just the depths of how difficult, hard, even exploitative and evil things can get, and they can be a container to hold all of the contradictions, all the dualities, but they choose to be generous and they choose to be positive, and they set aside a lot of the more basic instincts that we have from our fear center and the amygdala, because they know that if you play out all of the first, second, third order magnitude of what happens if you feed into the fear, it doesn't serve anyone. So I think of abundant people as they make that choice in everything they do, that, yeah, something terrible might have just happened to them, but they're not going to somehow subconsciously let that leak out on other people. And we've seen that in all sorts of anecdotal ways play out around us. Like you can see the billionaires who are severely unhappy and do self destruct, or the janitor who's supremely happy and blissful, and all they ever want to do is give things away to people. So that's definitely a mindset of choice, I think.
I love that answer for a lot of levels. It's fun. We enjoy asking that question to a lot of the guests that we have coming on here, and the answers are so, varying and fun, frankly. Um, I want to jump back to something. I'm glad we put this question in here because, as Matt alluded to earlier, I have a new son at home. I've been a lot of doctor's appointments with my wife in the last few months, and just recently I was in the doctor, and I happened to glance over the doctor's shoulder, and I saw her calendar for the day. And it was something to behold. I mean, I don't even think she had a bathroom break scheduled in there. I mean, it was something. So I want to ask you about your calendar, Dr. Ku. I mean, medicine can be an all-consuming profession, really. Not only from physical demand from having to meet the needs of so many patients, but the emotional side of things with regard to, the cancer discussions and these heavy life moments that people are dealing with. How do you work through both that physical and emotional demand so that you kind of, at the end of the day, have your own sense of balance and renewal, and you're recharged and able to take on the next day?
Yeah, yeah. Thanks for asking that question. So empathetic of you. Yeah, we are kind of jam-packed, but I also think of it like we probably in some ways did it to ourselves over time by not being realistic about just how much kindness we can extend before we get drawn too thin. And then I think the lifetime of a career for a cancer doctor is probably not as long as it could be, and we'll be coming into physician shortages and healthcare provider shortages where it's really important that we as a doctor start doctoring ourselves and just recognizing that this culture of, oh, I'm gonna put someone else before me constantly and I'm gonna work myself to death and I know you were talking about it's okay not to sleep. I'm a big proponent of sleeping. When people go on like, "Oh, I didn't sleep off," and they're like trying to sound cool, I'm like, well, I mean, naturally, if you don't need that much sleep, okay, but if you need a lot, like, please sleep. But yeah, I look at it like I'm very careful thinking about how I do this to the point where I think about the words I use in my life because it's almost like I cast a spell on myself if I use certain words. And I find that when I used to use this word like work-life balance term, it always felt like I was failing. But then when I started thinking more, and this is very semantic, but more this is more me playing with my own mindset. I thought more like integration. So integration meaning I've accepted that my spirit like eats, sleeps, breathes, lives medicine, but it also needs variety. And so then I'm thinking of, okay, if I have a really full schedule, I'm just gonna have to be aware that I might be running late with every patient. I might be kind of frustrated if I had a bad conversation and I ran even later. So I have these kind of conversations with myself and my staff. We do team huddles regularly, and I go, I think I'm not doing a very good job. So what can we do to improve this? And sometimes my staff will say, well, I can knock on the door and say, oh, Dr. Ku's just running like 10 minutes late. She didn't forget you. And I'm always apologizing. I feel like it's not okay to condition people to think that they should be waiting. It's a natural result of having to take care of all the demand, but I don't think we should condition people to think that's what they deserve. So I'm always apologizing, and I always want people to know I didn't forget them. And my team is really great about knowing my mind space and helping me out too. And they've saved my butt all the time. And I asked my family too, like if I have a work conference, then we're thinking, well, what can we do the week before, the week after, so it doesn't feel like I'm not honoring them. Sometimes I'll even take them to the hospital with me and we'll plan like a Sam's Club run or something and they go and have fun and I see my patient and then we reunite. So I think of like how do I make sure everyone I'm involved in my life feels heard, understood, and also that way I'm not burning out so that I don't feel like it's not okay to take some time to rest or to say like I actually have some needs too.
So did I hear you say, Dr. Ku, that you actually talk to yourself as opposed to listen to yourself? Because I
Yeah,
love that.
I just realized that sounded very strange. Just
It's not at all. We learned a lot lately. It's, we the general we listen to ourselves when we should be talking to ourselves, right? We hear those voices instead of saying, no, I'm not going down that path. And like you said, the choice is no, I'm going to, do things differently. So I love that.
yeah, that's a really fine, beautiful distinction. Like, I love how excellent of a listener you are because, yes, there is that voice that's always from our amygdala that holds us back. I think there's definitely going back to that abundant question of like, how do you, when you're uncertain, how do you approach something with confidence? How do you know it makes sense? I think if you're coaching yourself, then you'll feel that what it is that is coming across is that more going to hold you back and make you shrink, make you feel bad about yourself? Or is it actually more challenging you, like empowering you and saying, well, what if you did that? What's really at risk and more growth minded? Then you're building on your intuition and feeling like you can trust your intuition and how that's different from instinct, like jerk reflex that just is meant to keep you safe. So yeah, I have these kind of reflective moments with myself often. It's a regular mental exercise.
I love it. So
Thank you.
you have witnessed incredible courage in your patients. What have they taught you about gratitude and resilience?
Oh, yes. Yeah, I'm always reminded that, we're all patients. Like, at any moment, whatever's happening to them was really pure chance that it happened to them. Like, you could say, "Oh, well, risk factors and life choices," but a lot of the time, I have a little bit of this spiritual feeling that, really it's a lot of luck that it it's them there and not me, and any day it could be flipped. And whenever I find myself in a place where I'm thinking like, "Oh, I have to go to the hospital, I'm so tired," then I remind myself, well, they're stuck in the hospital and they don't even have a choice. So the least I can do is just show up and show that I care, and I get to go home and they don't. So it makes me a much more mature, better person when I think about what it is that they have to go through. And then I remind myself that I'm not above that. It could happen to me too. And I would really hope that there's someone who's going to intervene. And so I'm gonna make sure that I embody that because it's really, I think, frightening to actually be that kind of doctor that puts the wall and uses the justification that this is how we can be professional is by not being emotional. But really, I think being connective is very different from like losing one's ability to regulate one's emotions. So I think connecting with people very deeply like that, again, going to that abundance thought process where you can hold a lot of different emotions at once and not have to be so compartmentalized with just good or bad, but this is an entire experience. So yeah, they've taught me a lot. I think I've been invited into conversations I don't think I should have been invited into, like spouses saying goodbye to each other or parents saying to their children because of their diagnoses and being at end of life. Just witnessing that, feeling like, that's private and they let me be there. And I really want to make sure that I never forget, like, all of us are in all of this kind of experience.
Well, it sounds like you treat your patients like family is what's happening, right?
Well, I noticed very early in my career that they would always ask me, like, what would you do if it were you? What would you do if it's your mom? And I reflected on this very deeply and I thought, what are they really asking? And then as I got more seasoned, I actually became proactive and started talking to them like, I'm saying this coming from someone who knows this could be me, this could be my mom, because I think they're really asking that uncertain question. How do I see about this? When everyone's telling me 5 million things, how do I know what's right? Who do I trust? What do I believe? And I think being able to give them that anchor of it's not that there's a right or wrong answer. It's more what is that value equation look like in your mind? And so I run that equation in front of them and they know that I'm different from them. They know I can't tell them what to do. So saying that is actually a little bit hurtful to say like, "Oh, I can't tell you what to do," or it almost feels like a cop out like, "Oh, this is your choice, not mine." They really just want to see how do I work out problems and uncertainty myself and see me go through the same humanity that they're going through. So I'll play it out for them and show them like, I actually don't really know what I would do because I already was planning this trip. And then they'll see like how dumb my priorities are. We kind of laugh and have a humorous moment, but they know I'm not really telling them like, oh, like this is what you should do just because it's me or just because it's you. And I also am very clear to be respectful of boundaries that we're not literally family. Like, I don't ever want to exploit people's feelings in that way, but I will always think of it like at any moment our situations could be swapped. And I really want to be that kind of person who shows up and is helpful because I'm not in that place of fear that they're at. But I can give them the vantage point of someone who's not in that fear.
When working with families, we know that there's a lot that goes into healing and wellness. And how much does community, like our support system, play in that, in people in their wellness and healing?
Yeah, I think of community as specifically a very caring community, a very intentional community as being everything. And that's what I love about community doctors because we think so much about like the tools and the food and the like AI, like, and it worries us about well, how does that affect how we're going to take care of someone? It's not just the textbooks we read. And sometimes I can see the opposite happen where if a doctor is not thinking about community and they're thinking more like, well, I'm the doctor, that actually takes away from the patient care. So if they say, you just call me, you can call me anytime, and they give them their personal phone number and they're constantly working, then that just burns the doctor out too. So realistically, patients need to be able to rely on many different coping communities within a community. So that means like their family, or maybe they have some spiritual places they like to go to, or maybe there's something that's their hobby. And a lot of times they won't really talk about that with their doctor because they might feel like we're going to somehow look down on them or feel like they're questioning our care. So I actually really like to ask people what we call those social determinants of health. Like, who are the people that you live with who are going to help you? What's the safety net, like the very realistic safety net in case they can't help? What are the things that you could be doing to open up that safety net? And it's really interesting, I find that uh, the paradox of people wanting to really help when someone has cancer, and then cancer patients are actually kind of really there's like a stigma and a fear, and they don't really want to like burden or help people or change the way that scene used to be, and they're afraid of their hair falling out and declaring like a scarlet letter that they're different and it affects their community. But I think, if we could be really having these honest conversations and more trusting, that they'd see an inflood of people wanting to help them, and it's not like a charity or like a pity, but I think communities are built on that empathy that we evolved from, which is where we really want to and are capable of doing more for others than even for ourselves, because we know that that's how society goes on.
I think that that what that reminds me of is I have an elderly mother and mother-in-law who I have to constantly remind that it's a privilege to help them. They're so used to being independent and so used to being that I don't want to be a burden and that kind of thing. And so when you talk about that stigma, I think that that's really a big issue when it comes to redesigning healthcare from the ground up, truly, building a community-based model like you're describing. Um, if you could start it all, I mean, if you could start it from the ground up, what would it look like for you?
Yeah, and I always have to answer in like the most complicated, convoluted way, going back to like the beginning of time. But I was thinking about how if we could do healthcare entirely differently and not even based on like ideologies or financial structures, but just thinking like, what is it that really makes people sick? And I think of it like unequal access or inequality in general. Just there's a lot of inability to care for people that really doesn't have to be that way. So I think of social justice and being able to reach everybody and not have some of those barriers that maybe are accidental, but there's also prejudices. But for example, like having a hospital, you already start weeding out the very needy people, the people who don't have transportation or they have to work all the time or they don't have someone who can watch their children for them. So I think of if we could do healthcare differently, it would be very home based. Like I think of that old timey image of like the doctor who takes a black bag and goes to everyone's house and makes house calls. But now we have the technology where I could
I remember that.
oh shoot. I mean the just yesteryear, like 1 year ago. Like but yeah, so being able to go back not that long ago and have it where uh, utilizing technology to be able to bring care to the house. And that's not a crazy idea. I'm not saying anything new. I'm probably actually like taking ideas that are already very well known. There are large academic centers who talk about this home as hospital model, even for acute care, like maybe not ICU level care, but still someone being able to virtually watch someone else in their home to take care of them, because we don't really have to hold them up in a room and we don't really have to like physically be touching them every single moment. We have a lot of data that we can derive from just knowing the environment they're in. I think home is better. It's just a better thing. There's not a lot of those hospital acquired health problems where we actually hurt patients inadvertently, but just because we're like pulling them into one place where all the sick people are, but let them meet with their loved ones, with their familiarities. And then I think it actually drives costs down. It, this is the abundance part of me trying to speak here, but I think as we consolidate and make bigger hospitals, things get more inflated and more expensive, and a lot of times that falls on patients. And so I'd much rather go back to a very near recent time where we could envision taking care of people at the home, and that's really what community doctors do, is how do we go to the patients in a way that also acknowledges there's real world, like not just economics like money, but when you're spending resources on one person, you also have to think about how it affects the entire macro system and then like globally as well. And there's always a tension of like the one person and the whole society. So I think of it like the ingenuity is not the ability to go to the home, because I think we have all of that. It's more how do we balance taking care of one person but also taking care of like the whole world that way.
So to follow up on that, when you look ahead, what gives you hope about the future of healthcare and the communities that you serve, knowing, okay, in the not too distant past, it was this way and we're where we are now. So what gives you hope about the future of healthcare?
Yeah. I I think a lot of the problems that we have, it, because they're not really going to be sustainable, we're going to be forced to have to problem solve. We can't really just avoid some of these problems. So, for example, I think of rising costs as a big issue where people are afraid to actually go and see me because they're afraid of just how high the copay is going to be, even if they know they need that care, and even if they know in the long run it's going to be more expensive and worse on their life. Yeah, I think of cost as a big issue. I think of uh, the inequality gap keeps on growing because we have an incoming physician shortage, if not already. And a lot of those physicians live in those places that are going to be higher quality of living. So then those other folks get into healthcare deserts, and then they're going to be more ill, and then they're trying to seek the ability to get healthcare, and that actually just drives everything down when we can't think of ways to make a pie bigger, and we think of it like we can only cut it into small pieces and then hoard the pieces. So In a lot of ways, playing out the negative actually helps me think about how there's going to have to be some type of a reset, and it might be a slow reset, not necessarily like a big like crisis, or but it's more of a there's going to be maybe a generation where I feel like I'm in the millennial generation. We're already seeing it, and probably the younger ones even both coming up from me. They're going to be seeing there are a lot of these problems that really need a different way of thinking. It's not just the administrative, it's not just the medical research, but like all the social responsibility. I'm already seeing a lot of this, and I feel like part of my abundant path is to try to help all those who are up and coming not get deterred by things that are just short-term seasons, but really later they're going to be able to harvest great benefit if they can get through the ardors of uh, the day-to-day experience in the clinic, or they get through the training and they see past some of those harder things so that they can get to that point of really solving problems in a meaningful way. So I look at my role as trying to keep steadfast and help the next generation because we really need to solve all these problems.
Agreed.
Dr.
Agree.
Ku, you spoke a lot about empathy today, community driven work that you do. I know we didn't even really get to touch into some of the other work that you've done with organizations like the Black Swan Group or Abundant Studios and some of the charitable efforts you do over there. But for anybody out there that really enjoyed today's conversation and the kind of community centric and focused approach that you bring to these difficult circumstances that somebody can come into in their life, and they want to learn more about you or they want to connect with you even online in some capacity, what is the best way somebody could look you up, find you online, dare I say, open up a dialogue? What's the best way somebody could connect with you?
Yeah, I love being in social media as a way to reach out to people. And so I'm on LinkedIn, Facebook, Twitter, Instagram. I'm looking to expand my website clinician expertise, but I also have a website through my practice, Illinois Cancer Care. And just in general, if you just Google me, look me up, there's probably some way to reach me. So I really encourage people to please do that. I actually have folks who will reach out just wanting to know a different way of thinking because we have to be embracing out of the box ways of approaching medicine if we want to change it.
Well, Dr. Ku, we so appreciate you carving time out of your busy schedule to jump on with us, make us a patient, if you will, for the day, and give us some of your time. But, we wish you all the best in your continued success. And, we look forward to hearing more from you in the future.
Yeah, I really appreciate this time. Thank you so much for sharing all of your many years of wisdom and how you're helping people in your community. My parents live in Michigan. I'm from Michigan, so very much appreciate the uh, universe synchronicity.
Alrighty, folks. Well, there you have it. Dr. Kimberly Ku joining us from Illinois Cancer Care. Just what a great conversation. I mean, I've got thoughts of my own, of course, but Matt, why don't I toss it to you to bat lead off here? What were some of your big takeaways from the conversation?
With a triple board certified, right? You just think, okay, what it goes into to achieve that. But then you can tell that she really genuinely cares about her patients and her community at large, right? And we're, as they say, we're all in this together. And so to have someone like that who is really a lifelong learner who will listen to people right when they come in, because hey, if it's on the internet, it's got to be true, right? And so she'll listen to people and help them through what, none of us want to go through and hear that, oh, you have cancer, right? But to have someone like Dr. Ku fighting for you, that's really encouraging.
Yeah, I couldn't agree more. That deep sense of empathy that she brings into the conversation is, I think, exactly what somebody needs in some of those deep emotional moments. Scott, what about you? What were some of your takeaways?
I think that just the forward thinking about, you know, where healthcare goes in the future, and it's being community based. And, you know, at first I would have thought I probably would have had some pushback when it comes to the virtual type of doctor. But then I think about the challenges that are ahead, and I think about how do you duplicate her effort? She can only be in one place at one time, and that's going to be the case with most doctors. And so, obviously, technology is, as much as sometimes I wake up every day and ask myself, do I want to put in another password and another two-factor authentication and all of those kind of things? I think about this is where technology is going to help. It it is going to improve our access to better healthcare. Um, you know, even if it means that, you know, she made she made the alluded to the doctor, you know, that used to visit the home, and she saw the benefit of that. So, you know, where's that balance going to be between that community-based doctor that, you know, I grew up with at times? You know, I'm not, and it wasn't that long ago.
I love.
I think about, you know, how important the doctor was in that little community. And, you know, short of it being a little house on the prairie, it was something where, you know, if the doctor came into your home or you went just a few blocks down to see your doctor, what they had to say meant something. And, you know, you walked away from it with, okay, that I'm going to make those changes in my life, or I'm going to, you know, I'm going to take care of those things. So I think that that's a big challenge that she puts out there. I'm very curious and hopeful that that I'll see the fruits of her labor, because it sounds like she's going to be very, you know, she's making it so that she wants to be part of that change.
Mhm. Yeah, very much so. And it's funny. I think if you have this exact conversation with a lot of doctors in today's day and age, you know, about what they view the future of healthcare as, I would wager to say 6, 8 out of 10 of them might say, "Oh, well, the innovations that artificial intelligence can bring to us and the new medical solutions we can have." So it's very interesting to hear, you know, the other side of it, where actually, no, it's almost not necessarily the technical side. It's getting back to that grassroots, like, you know, taking the black bag from door to door. It's very interesting, but I agree with you, Scott. I think that that greater solution lies somewhere in the middle of those two fantastic realities of being able to get that personal level of care, dare I say, in your home, and then coupled with some of the amazing solutions that can exist in the future. So, it just,
We all, so if we tell people all the time, right? It's we're creating confidence in people in their financial world, and Dr. Ku does the same in her world. And so how do you, which she sounds like does a great job of, right? You take that tactical empathy and in the home, as well as all the technology that's out there, to give people the confidence to move forward, whether it's their financial life or their physical life.
yeah, it's a beautiful blend, between those two worlds there, Matt. Speaking of, for anybody out there, as we always do on these episodes, if, you know, they're hearing today's conversation surrounding health, you know, chances are they might be thinking about their own health and maybe a challenge they're up against and the ripple effect that that might have on their given world. And let's face it, the last thing somebody wants to be thinking about when they're going through a medical issue is the financial repercussions and whether or not they can get the care or afford the care that they want or need to receive. Matt, Scott, for anybody out there that would enjoy and benefit from just sitting down, having a conversation, diving into their financial world so that, you know, God forbid, an issue pop up down the road, it's not necessarily worry. It's something that's been pre-thought, pre-planned. What's the best way somebody can reach out to you guys?
The traditional way, pick up the phone, 517-333-7967, or go to our website, Morrison Nordman, with two N's on the end.com. You can schedule a call right there. We'll talk through some things. And again, the whole goal is to how we can help and have a significant impact on the lives of the people that we work with each day.
Fantastic. Well, I'll let you guys get back to spending time with your clients. I know you've got some meetings later in today, but Matt, Scott, appreciate your time as always, and I'll see you back here on the next one, fellas.
Great to see you, Ryan. Look forward to it.
Yeah, see you guys soon. And look, folks, we want to take a final moment, as we always do on this show, and thank you for making us a part of your day. If you enjoyed today's discussion, if you learned a thing or two, I know I did, make sure you hit that subscribe button on whichever platform you checked us out on so that you don't miss out on future conversations where Scott, Matt, myself, we sit down with just these extraordinary experts from different walks of life so that we can ultimately provide you with some value and in their expertise and of course, some considerations for how it can be applied to your own world. But look, for Matt and Scott, I'm Ryan. We're going to go ahead and say so long now, but we appreciate each and every one of you guys stopping by and being with us today on Path to Abundant Living.